Could you please introduce yourself and let us know what is your specialization?
Kyle Taft. I'm a physical therapist out of LaGrangeville, New York.
All right, and why did you choose a PT profession?
When I was in high school, I got hurt and I'd had to do PT for my ankle. So it was one of those things when you're in high school, you decide on your entire future. And then it was just like, oh, I could probably do this. And I just kept going through college. And then now I'm here.
Oh, sounds really interesting. And how long have you been practicing physical therapy?
Since the spring of 2015.
Oh, okay. Okay, thanks a lot. And in your experience, what are the most common mistakes patients make during rehabilitation?
I mean, the biggest issue, people are impatient. People expect results immediately, or if they had surgery, they expect everything to be healed within a couple of weeks when it takes a couple months. That usually will be when there's a mistake where there's the need for another surgery. It's when they decide that they don't need the brace or the walk or the crutches when they walk, and then they slip and something tears, or they're just impatient with physical therapy and the doctor, and they don't think that they can get better on their own, so they stop coming. And then I see them 6-9 months down the road for a similar issue was just caused by not wanting to do what the medical provider suggested, and they kind of did their own thing and things got worse.
Got it. And how do you onboard patients to weight bearing, and how do you ensure weight bearing compliance?
Weight bearing is usually determined by the surgeon, who will start off with a percentage. Sometimes it's 0. As a 0 goes from 0 to toe touch, which is less than 20%. From 20%, usually it's 50, and then from 50, it's just weaning on to full. Prior to getting the device, you kind of just would guess, right? So if it's 50%, it's your body weight when you're standing on both feet, 50%, or you'd break out a scale and you have to kind of guess as far as, okay, if you weigh 150 pounds, put your foot on the scale. Let's see where you're at. Okay, that's the amount of pressure you're going to walk through with the crutches. It's usually an estimation at best, not anything accurate. Usually you side on the air of caution and say, hey, put a little bit less pressure on there, but you don't really know. It's just, you try to use 50% is a little bit easier, but when you're doing toe touch, it's very little bit of weight, but weaning someone off the crutches or trying to increase their weight bearing status is usually the more difficult part.
All right, thanks. And do your patients express concerns in regards to weight bearing?
The biggest concern, the thing I always hear, is they don't know, like, what's 20% even mean, or what's this even mean? And most of the time you have to kind of break it down as to why. A lot of times people have either a surgery where there's tendons that are repaired, or ligaments that are repaired, or there's a fracture, so there's pins, screws, and that stuff takes time to heal. So if you put all the weight through it, it's not going to heal the right way. If you don't put enough weight through it, it won't heal the right way. So describing to the patients that, hey, you got to put 20% in means that it's going to heal the appropriate amount without risking injuring the, either if it's a tendon graft or a ligament graft, so that things get better, not worse. That's the hardest issue, is describing, okay, this is why you got to do it, in order for them to be compliant with actually doing it versus just kind of going rogue and doing their own thing. That's the most common thing.
And by the way, what can happen if a patient applies, too much weight on the injured leg? What are the consequences?
I mean, it depends on the actual injury. I've had a patient last year had a quad tear, retore his quad 3 times because, one instance, just too much weight, not enough weight through the cane, and he retore it. Another time he was, should have had a cane. He wasn't using his cane, and he slipped, and then he tore it. So that's a big one. And a lot of times you'll also have patients who, if they're putting too much weight through their leg, could damage the tendon or the ligament graft that they put in, or the instruments or the plate, screws, rods, whatever you want to call it, that the surgeon will put in.
All right, and what can happen if a patient does not apply any weight, or applies not enough amount of weight?
The most common thing is they're just stuck on that crutch, that cane, that walker for much longer than they need to, or their foot is the most common thing, right? If it's a foot or an ankle, they don't want to put pressure on it, and they're hesitant to put pressure on it. They don't have the function that they should at a certain time period. They're not able to do stairs and not able to walk without a crutch or without a cane or without a boot on when they should be by that point. They should be most of the way done with rehab, but they're just too afraid or too hesitant to put the weight in it.
Thanks again for this information. And but actually you've tried the product with a patient. Congrats. So how useful is the product on a scale from 1 to 10? So 10 is like super duper useful and 1 not useful at all.
I got you. So it's a lot of it's dependent on the patient themselves, right? So I have I have 3 patients all with like ACL tears with a meniscus cleanup. And they're just slowly putting a little bit of weight on it. Those people are much younger. So they're teenagers, high school, ranging between 14 and 16 years old. They're super compliant. I would say for them, it's like a 10. They're able to use the app effectively. They're able to track the way they step effectively. The only rule is like, hey, if you're in school, you can crutch without putting weight down so you don't get trampled in the hallways. But other than that, walk the way I taught you, and then it progresses them out. I have some of my other patients that are using it when they fractured their ankle. I would say it's compliant, maybe a 6 or a 7, right? They're able to use the app. They're able to use the device, but it's just a little frustrating because they're not so tech savvy. And then it's good because, and then it ranges to his wife is also more tech savvy than he is. And it gets him in trouble when he's non-compliant with the way he's supposed to walk because his wife sees it. And then all of a sudden he gets in trouble because he's not walking it the way he should. So that way, there's extra compliance on that back end as well.
All right. And what part of the service gave you the best value?
The best thing for me is just to also see that, okay, these people are doing what they should. The biggest issue for me is people not listening. And I wouldn't say it's an issue of not enough pressure at this point with the people I'm using it with. It's too much pressure. So I have, the gentleman I was talking about where his wife yells at him if he sees it is more or less the too much pressure, trying to overdo it. With the teenagers, it's a little bit less of too much. It's just a matter of doing enough, putting enough weight through it so I can track it. And it's also, I see the percentage like, hey, you're not doing enough. Week 1, you're taking, several thousand steps a day. Of that several thousand steps, you're hitting like 60%, which is good. Week 2, you kind of fell off. So when they come in twice a week, I can say, hey, you got to step your game up and get more compliant with putting more pressure, or like, hey, you're being an idiot, don't put so much pressure on all the time.
Okay, so actually you did check the patient's progress. So how often did you usually check it? Like once a day?
I'll check it more or less when they come in always, right? So between visits, I'll check and I'll see, all right, how's it going? Is everything going good? Is the charging going well? Is it still indicating the way it should? And if the answer is yes, then I'll pull up their thing and then I'll look and see where their steps are. If their steps are, 50% or better, it's usually, okay, you're good, especially if you're walking in school. But if it's less or in between, we talk about why they're doing, whether it be like, hey, I just didn't have school on this day, I'm not walking as much, so I have a better score, or hey, I had to walk through school a lot, so I couldn't put pressure through my foot. Maybe if they're having trouble, I'll do a checkup. Like I'll just look, end of the day, I'll just go through all the people and see how they were for the week if I haven't seen them in a couple of days. But other than that, maybe between visits and then when they come in is how often I'm looking.
All right, got it, thanks. And if the patient's insurance could not cover the device, how much would you charge for it?
I would be, the most likely scenario wouldn't be a charge for full purchasing. I think the average, for renting, if I would say $50 or $50 a week would be a reasonable price. And then from there, just seeing how it is. $50 a week is pretty reasonable, I think, for what it does. And then also, it's at the end of, usually it's going to be 6 weeks, they'll be done with it. And they don't need, all that extra stuff.
Got
You
it.
know, you have some, I
Oh,
would
yeah.
say, yeah, week to week would be more likely a better scenario than like a flat rate. Just because you have some people who are 4 weeks, some people are 6 weeks, some people are 8 weeks. So it's just different needs for different people.
Well, so we know that you help patients after like lower limb injuries, right? So how many did you have during the last months? Maybe you remember?
So I have 4 that are currently onboarded in the app, ready to go. I have a 5th that hasn't come in since I got the new crutch. That'll be another weight bearing patient, and that's within the last, I think, 3 weeks, 4 weeks. I don't remember when I started up, but that'll be pretty consistent until springtime. Once the winter happens and more people slip and fall, there's a lot of fractures, so there'll be much more of it. But I would say 3 to 5 a month is a high. 2 to 3 is more likely. A lot of times that's partially because they don't come until after their weight bearing orders have been discharged. So they're in the boot or they're in the crutches from the surgeon, and then they do their 4-week or 6-week follow-up with the doctor, and then they start PT. I would say a good portion of my patients do have weight bearing changes. I just never see them until after they change to full.
Okay, got it. And how many devices would you need for annual usage to cover your weight bearing patient demand?
Right now, it's been a month. I would say we're at 5. I could probably do another 1 to 2. So 6 to 7, and then we'll see. It all depends. It's hard to say, right? So 3 weeks in, if we do 6 to 7, that'll probably, any new patient that comes in will be able to use the crutches that are returned from a patient that finished with them.
Okay, yes. And how much are you ready to pay for an annual subscription on the condition of all-inclusive service per device?
I have no idea. As far as the annual price point, I would have to, look at the whole return. I wouldn't be able to give you an accurate answer whatsoever. As far as if I have 5 patients at $50 a week, who knows? Comparable to other medical devices that I use, and that's just a $300 device is a drop in the bucket. Anything more is like, okay, we have to look at numbers. Anywhere on the north side of $500 is like, okay, I have to talk to the owners as far as purchasing, versus anything less is just like, hey, we need this, we'll get it.